You're listening to international investment advisor Doug Goldstein on the Goldstein on Gelt Show, the financial show where we'll talk about how you can make the most of your money. With all the confusing financial chatter bombarding you each and every day, Goldstein on Gelt will give you the practical information you want and need about living a financially stable life. Here's your host, money maven Doug Goldstein.
Okay, we are back. I'm very happy to have on the Goldstein on Gelt Show Professor Dani Bercovich. He's an expert in molecular genetics. He's the head of the MSc program in biotechnology at the Tel Chai College, and he's the scientific director of Galil Genetic Analysis. And on the Goldstein on Gelt Show, he is what we would call a real high-tech hero. Dani, real pleasure to have you.
Thank you very much for having you.
You've been getting a lot of press recently about some of the research you're doing as a geneticist, which is really quite amazing. Can you tell us what you're working on these days?
So we actually develop and give services in molecular genetics for people who are in risk for having all types of cancer, which could be breast or ovarian cancer, colon cancer, and also prostate cancer. Some of the people are predisposed to this types of cancer because they were born with a genetic defect in one of the genes which are responsible for correcting our DNA all our life. And if some of those genes are not working properly, the risk of having cancer in our lifespan is getting much higher. It could be up to 80 to 90% in some type of the cancer. And if you can identify in advance people who are predisposed to those type of cancer, there's a lot of ways to try to prevent or to reduce the risk, like monitoring the organ, going to clinical, to test, to do MRI, to do ultrasound, to do blood test. And also, if by chance a cancer does appear, there's a lot of treatment that can be done specifically to people who harbor some of those mutations, because some of the new biological entities that were developed to treat cancer are aiming on specific mutation in those genes, and if somebody has those genes, those treatments will work very, very well on them.
So just to clarify, you're able to look at a person's genetic structure, which I guess just means a blood test or something like that, and then you can say, we've looked at your genes, and based on some flaw that you have in your DNA, you have an 80% chance of getting prostate cancer. Is that how this works?
Prostate, colon cancer, or breast or ovarian cancer, exactly. So people who harbor those mutations on their lifespan, which can be between 70 to 80 years, have a high risk of developing those type of cancer. And we can identify those people who are high risk, and as I explained before, there's a lot of things to do, including a regular thing which will include diet and sport activity and regular monitoring. When it's a breast cancer, usually it's easier to detect because you can monitor it. Women can check herself. She can go to a gynecologist to be examined. But when it's an ovarian cancer or prostate cancer, then it's much more tricky to identify it. And if you don't know that you're at high risk, sometimes you don't do all the measures to prevent it.
Okay, so let's go through the case where someone is concerned about this and he goes to your clinic to get checked. Is this a theory that you have, or is this already in practice that people could really use it?
No, we're talking about genetic tests which are in practice today. Today, people who will go to some of the oncologists who collaborate with us, their blood sample will be sent to our genetic center, and we will screen their gene relate according to the type of cancer which is known to be common in their family. For instance, if it's a prostate cancer, it's common in those family, we will screen 12 different genes, which mutation in those genes are known to be common in to be predisposed to prostate cancer.
We are talking with Dr. Dani Bercovich, who is the scientific director of Galil Genetic Analysis, which has developed an amazing ability to look at someone's genetic structure to determine the odds of perhaps getting cancer. He is, in what we call here on the Goldstein on Gelt Show, a real high-tech hero. Dani, you've been talking to us about the practicalities of going to your doctor. He takes a sample and he sends it to your lab. When you do these tests, and not being a DNA tester, I don't know, is this an expensive procedure?
Well, today, unfortunately, it's a bit expensive. It depends, of course, on what you call expensive, because if you will try to do this same test 10 years ago, it would have cost you about $50,000 to $100,000. Today, we are talking about $1,000. $1,500 test, depends on the type of test exactly that we are doing. The main problem with those kind of tests is they are still not subsidized by the government. So people are getting reimbursed by their own insurance company. It could be their HMO insurance company or the private insurance company, or they just pay out of their pocket. But still, if you're talking about cost effectiveness, this is one of the most best way you can spend your money to plan your life ahead, to make sure that you're not going to spend much more money afterwards because you didn't do the preventive medicines that you could have done.
It certainly seems that a lot of governments are a little bit short-sighted about doing preventive medical care because they don't want to spend the money today and just assume, I guess, they'll kick the can down the road and deal with it then. So based on what you're saying as an investment in your own health, people should maybe even want to pay for this themselves so that they'll know what to expect in the future. With what level of certainty?
Okay, so first of all, not all people who have cancer have mutation which cause mutation in known genes which will cause them to be predisposition to those type of cancer. Okay, about 15% of the population harbor when they get cancer. We know it's on a known genetic background. Okay, all the rest are all sporadic because they were exposed to chemical or other things. Or it's another genetic compound that we are not familiar yet, but we can still know it in the near future. And you are right to indicate that this is one of the most effective way to invest in your health, to know, especially we are talking about people from family where they are known to have cancer in the family, okay? So somebody in the family already have one type of cancer. If a woman in the family has breast cancer, all the male in this family should be tested for prostate cancer as well, and colon cancer, not only breast cancer. This is one of the concepts that we are now trying to change, that people will know that if there is breast and ovarian cancer in the family, and people are known to look for only mutation in the women, they actually need to screen also the male in those families because they can suffer from different kind of cancer, which could be colon cancer or prostate cancer.
If your parents get this test, because they're the ones giving you their genes, can you just rely on their results and assume that it was passed down to you?
Yes, if both parents are undergoing those tests and no mutation is found, okay, so it's likely that their offspring will not be at higher risk than the general population, okay? But if one of the parents harbor one of those mutations, because cancer is mainly a dominant inheritance, which means even one copy, which is defective of the gene, which will be inherited, can cause cancer.
So let me go back to this one other point. You mentioned that some of the Kupot Cholim, the HMOs, do pay for this service, but the government doesn't really see this as something important yet. Do you think that this is something that the government really should make across the board in order to invest in the healthcare of the whole population?
The government is investing more and more money in genetic testing because it's preventive medicine. But it's a very slow process. We know that they invest in screening free non-mutation in the BRCA1 and BRCA2 gene, which are related to breast and ovarian cancer. But this is not enough. This is old news. This is medicine 15 years ago. We are now in the 2015, where we can screen 60 gene, the full gene length, to find any mutation, not only common population mutation. And the government will be there, but it will take some years, I predict.
I see. Well, we'll have to hope that it changes. It's very interesting, and unfortunately, we are just about out of time, but I think that what's interesting for people to think about in doing this sort of testing is the impact that it would have on your financial planning, because if you know that your odds of getting a disease are very high, for example, I think that as a financial planner myself, I might give you different advice than if I didn't know that. And having more information like this could hopefully make people, in fact, make better financial as well as healthcare decisions. But Dani, that's going to have to be a topic for a different time. So in the last few seconds, tell me, how can people follow you, follow your work? And if they want to get tested themselves, what would be a concrete step they could take today?
So first of all, there's a lot of stuff in the web that you can go. You can go to our web, which is www.gga.org.il, and you can see the website, a lot of information. But also you can go to the oncologist, as I mentioned before, Professor David Margal from the Beilinson campus. He's an expert in screening people to find those who are predisposition to those cancer using our services. So if people will go to oncologists which are familiar with all the latest advance in the molecular genetics tests which are available, one thing I just want to mention, which is very important, and this is in comparison to other people who offer some type of test which could be similar, we are the only lab in Israel which perform the test in Israel itself. We are not people who take samples and move it abroad and send the dollars abroad. And there's a lot of oncologists and physicians who take samples and send the samples abroad. After the sample, the money go abroad, the dollars go, and just they export money instead of using internal capability in Israel. And we are the first lab in Israel who gives these services. So this is another point. From economic point of view, it's good for Israel to do the test in Israel when it's available.
Okay, and we will put links to that so people can find these resources at the show notes of today's show at www.goldsteinongelt.com. Dani Bercovich, thanks so much for your time.
You are most welcome. Have a good day.
You've been listening to the Goldstein on Gelt Show with money maven Doug Goldstein. Doug's weekly radio show is heard around the world, but if you miss it, you can download the podcast at www.goldsteinongelt.com. The Goldstein on Gelt Show gives you up-to-date financial ideas so you can get on the path to financial freedom. If you'd like your questions answered on the air or off, send Doug an email to doug@profile-financial.com. It's your money for your future, so join Doug every week to build your wealth on the Goldstein on Gelt Show.